Good morning.
Morning. Yes, sir, Mr. Smith.
Mr. Chairman and board members, we have Aaron McAuliffe with the Senior Center to give you a presentation on senior services in Wayne County.
Good morning. Thank you for inviting me. There is nothing I love better than talking about Wayne County Services on Aging, so it's a thrill to be here. As you know, we are now located at 2001 East Ash Street in Goldsboro. We moved there last October. We had been at 100 South John Street in downtown Goldsboro before. And I want to thank the commissioners, I want to thank the county manager, thank the public at large for our beautiful new building. I heard them talking at Cooperative Extension, and I do remember and understand having issues with a building. So now we're just so blessed and so thrilled to have a beautiful facility. The public also is very thrilled about this. I'll tell you, we have signed up 700 new seniors since November 1st. I wondered if that translated into actual use of the seniors, use of the center. So we have a computer system where people swipe in each day when they come and they list what activities they're doing. And for March, so far in March, there have been 500 different seniors in that building participating in programs and activities and all. Last March, in our previous building, we had about 150 different seniors. So you built it, and they're coming, and I thank you. The Senior Center was named for our Senior Tar Heel legislator, Peggy M. Seegers. She has been the Senior Tar Heel legislator for 20 years now, since its inception. Peggy was a very strong proponent for the building, a generous donor, and a good fundraiser. So I think it's very appropriate, and we're very happy that the building was named for her. The mission of the Wayne County Senior Center is to enhance the lives of older adults through programs, services, and activities which encourage independence, involvement, and advocacy within the community. Our hours of operation are Monday, Tuesday, Thursday, and Friday from 7:30 in the morning till 8:30 at night, Wednesdays from 7:30 until 6 p.m., and Saturdays from 10 to 2:30. And what's interesting I'm finding with these statistics, I was looking to see if the same proportion of seniors are coming as before, these 60 to 65 and 65 to 70. The statistics are about the same, the percentages, except for the young seniors. The young seniors, it was about 11% of my population before. Right now, it's 22% of my population. And I think that has to do with the later hours working seniors can come, our fitness room, and our ability to offer more programs. The Senior Center is free to all Wayne County residents age 60 and older. I don't know if you've read the wonderful article that Steve wrote in the paper, but we now actually have to card seniors when they try to register for the Senior Center. We found they were starting to lie about their age or lie about what county they lived in to get into the center. So for me as a director, that's fabulous. I think it's wonderful. People younger than 60 are trying to get in and are lying about it. So we now have to ask for...
They weren't happy when I was 17 and carded.
And I think it's great.
Okay.
It's a positive thing in Wayne County to turn 60, and that's wonderful. So now we do have to ask for proof of their ID to make sure that they are their age and they are the proper county. The Senior Center is funded. We received $479,476 in funding, grant funding. This is state and federal money that originates from the Older Americans Act. Eastern Carolina Council Area Agency on Aging that's the body that allocates our funding. These allocations are based on the percentage of seniors in the county, the percentage of low income, and the percentage of minority. Our total budget is $994,528. So basically the county is paying 50 cents on the dollar. I also always spend my grant money first, trying to turn money back to the county at the end of the year. I'm happy to say we were just recertified as a Senior Center of Excellence, and that gives us an additional $11,753 a year. This is the grant money that has the least number of strings attached. They let you use it for parties, dances, any of those little extra things that you might want to offer your seniors. Wayne County Services on Aging is not a state or federally mandated program.
Got a question before we move on that. Since you've moved into the new center, has your your budget actually increased? I mean.
Yes, we have nighttime staff. We didn't used to be open nights or
Right.
weekend, so it was about $31,000 for 2 part-time staff members for those hours. And then I'd say probably a couple $1,000s in supplies, and then what they call, what is that cost center, the utilities, what was that term?
Part of indirect.
Indirect cost, they call it indirect costs, and that's utilities and heating and things like that. And I think that went up about $20,000.
So the current budget year, you all had really already budgeted for the moving into the new center?
Yes.
Yes.
Is that correct? Thank you.
Staffing, when I talk about staffing, this is staffing for Wayne County Services on Aging, which is the senior center plus my staff that works in the community. It doesn't just relate to the senior center. So we have 6 full-time employees, including myself, 4 regular part-time employees, and these are people that work 20 hours a week. We have 25 certified nursing assistants, and these are people that go to the houses of homebound elders and give them baths, and some of them work 5 hours a week, some of them work 10, some of them work 20. We have 4 employees who teach classes, and some of these will work maybe 1 hour a week or 3 hours a month, but the way the IRS regulations are, they're still considered an employee. And we have a part-time ship counselor, which is 100% grant funded. We could not run all the programs that we have on such a small staff without our volunteers, and I am very, very grateful for them. We have about 70 volunteers now. They run the range of administrative, they teach classes. I have one teaching hot yoga, which is really exciting for people. They help in the respite program, they help in the meal site, just basically every area. So our volunteers are essential to us. I also supplement with community service workers, people that have gotten into trouble with the law and have to do some community volunteering. We'll have them do cleaning or facility kind of tasks. We have Title V workers, which is seniors who are low income and need job training, so we take them on and we work with them and train them, and they help also as they learn. And then I'll use college interns. Last month alone, our volunteers gave over 1,000 hours of service to the center. We are a congregate meal site. WAGES provides lunch Monday through Friday to seniors 60 years of age and older. Our meal site can fit 210 seniors. This large room is perfect for dances, health fairs, and parties. WAGES is currently serving about 120 lunches a day now, and in our other center, previous center, it was about 75 to 80. So that has grown also.
Are you at capacity?
We're not at capacity yet, no.
What is capacity?
210 for that room.
Thank you.
We provide a lot of activities and classes. We offer many classes and groups that are free: jewelry making, arts and crafts, learn to play billiards, learn bridge, chair exercise, crochet, knitting, and more. I'm happy to say in April we're offering some additional programs. We have a nice volunteer that's going to do Monday night bingo. We also are going to be offering shuffleboard lessons on Tuesday nights. A retired fitness instructor is going to volunteer their time. And then one of our staff members became trained in Zumba, and we're going to have Zumba Gold for seniors on Thursday nights. So those are new to April. We've been able to add programs every month, so it's exciting, and keep watch for our calendar. The Senior Center also offers classes through Wayne Community College, and what we do with those is the college sends teachers to the Senior Center, and the seniors can take the classes right there. And we have classes in computer, basic sewing, lingerie sewing, and Bob Ross painting. Those classes, there is a charge because it's through the college, and that's $35 a class. We're hoping this spring to offer Spanish. Encouraging seniors to be fit is very important with us. We have a fitness room now with equipment in it, 10 pieces of commercial grade equipment. And when I was looking at my statistics, last March, we had about 47 different people who used our fitness room. This March, 225. That's a benefit to the community. You're going to have healthier seniors because of the senior center. We also offer exercise classes, health screenings, educational classes. We just had a health fair in March, and we had 400 people attend this health fair. There were skin cancer screenings, depression screenings, dementia, hearing. We had expired medicine drop-off. We had a pharmacist there. Once again, all aimed at helping the health of the Wayne County seniors. We also have an outdoor park area with a walking track and picnic tables and a shelter. Betty Thatcher is associated with Cooperative Extension, and she's trying for a grant, which we're, fingers crossed, hoping she gets. And if she does, we'll be able to put in horseshoe pits and raised garden beds. And this little park area is to the side of veterans, and it's all fenced in. It's just for the seniors. They really like it. It's a safe place to go outdoors and enjoy the weather. Some of our seniors, don't get a chance to do that, don't feel safe going out. So park is going to be used a lot. We have an award-winning choir. They're called the Songbirds, and they travel all over the county. They go to nursing homes, they go to assisted livings, and they perform and entertain. And this is one of the things that I think is special about our senior center, is our seniors really give back to the community. We have this choir that goes and entertains others. We have a crochet group that has made lap robes for the veterans, has made baby bonnets and booties for the hospital. They are currently made 70 hats for the Boys and Girls Club. They give back. We also were able to, just this week, the Arts Council had a big mailing they had to get out, and they approached me because a lot of their volunteers are seniors and said, can we just bring the mail to the seniors and have it done at the center? So they brought all their envelopes and flyers and everything. The seniors all got together and helped them and got it done in a day and a half. So our seniors really give back. We offer other programs. We have a computer lab with internet connection. So this is open to all the seniors if there's not a class going on. Seniors are searching the web. They're doing online shopping. They're looking for jobs. They're doing genealogy searches. And I will say also very popular, spider solitaire. So they like it a lot. We have a billiards room with 2 regulation-sized billiard tables. We have tournaments now. We're offering free lessons. I don't know if you know Howard Bass, but he got the silver medal in the state competition for Senior Games Billiards last year. He knows his stuff, and he's helping to teach billiard lessons for free to any senior who wants to learn. And we're also going to be the site for the Senior Games Billiard competition.
He's a billiard shark.
He is.
He is.
If you want to learn, you will
Just
learn.
go watch the guy.
I played
He's
him one
amazing.
time and he got my quarter.
I said, don't do it.
We also offer something that's called evidence-based classes, and this is something the state is encouraging. These are classes that are designed in colleges and universities that if the senior attends all series of classes, it might be 6 classes or 8 classes, that there is a proven positive result. So, for example, this one's called Chronic Disease Self-Management. That's for people who are suffering with a chronic disease, arthritis or heart disease or Parkinson's, something like that. Instead of letting the disease control you, you learn to control that disease. You learn how to make the most of it. And we offer that. We offer one called Healthy Living with Diabetes. We offer one Matter of Balance, which is fall prevention and arthritis exercise. We have 2 full-time social workers. Nancy Davis, our information assistant social worker, handles over 100 to 200 requests each month for advice and assistance. We get calls from family members that are out of state and mom is in Goldsboro and starting to have trouble. What can be done? Seniors need a ramp built, or someone was evicted from their house. A whole myriad of questions, and Nancy handles those. Now that we have the new building, we are able to house Mary Jones. She is a social worker for the blind. Her funding, I believe, is state funding. She's not part of our budget, but we were able to offer her space. Many seniors have visual difficulties, so this makes it easier for them to get that service. We have Medicare counseling. We have a dedicated group of SHIP volunteers, that is the Senior Health Insurance Information Program, and a part-time staff member, Yvonne McLam, who I will say is the most knowledgeable Medicare counselor probably in the state, that helps seniors navigate through the red tape of Medicare. We also have an in-home aid program. Our in-home aid program sends out certified nursing assistants to approximately 100 homebound seniors. They assist with personal care in order to keep these seniors out of nursing homes and other facilities. And I'm so dedicated, I am the leg there that you see in the photo, because no one else would pose for the picture. And I said, all right, I'll do it. But this is a really important program. Many people cannot afford an aide to come in their house, but with a little bit of help, maybe with a bath and some skin care and someone to do the heavy cleaning, they're able to stay home. So we have 100 people. There probably are 100 to 150 on the waiting list, but it's a fabulous program. We also have a Group Respite Program. And this is for people with memory loss. Caregivers drop off the family member for the day at the senior center so they get a break. If you take care of somebody with Alzheimer's, it is a 24-hour day, 7-day-a-week job, and it's extremely stressful on the caregiver. So if they can even just get a couple days a week to go do errands or go home and take a nap or whatever, it really helps them. But what I love about this program, the beauty of it, is the person who has Alzheimer's gets to come to the center and enjoy the center. They get to go to bingo, they go to Bible study, they use the fitness equipment. We have volunteers and staff that keep them safe, but they eat lunch with all the other seniors. It's just fabulous for them to also participate and succeed despite the fact they have a disease. There's also a support group for caregivers on the first Wednesday of the month, and that's at St. Paul's, and we're involved in that. And this is a photo of Jody Glosson, our newest staff member. We also try to utilize other agencies in town. We partner with them to provide additional services. The home and health agencies around town will send nurses and nutritionists to do programs at the center. We have a lawyer from Legal Aid who comes quarterly to do a wills clinic with the seniors. Social services sends social workers out to do energy assistance in the wintertime. We have housing advice. Ethel Barnes from the Social Security Administration comes monthly to meet with seniors at the senior center because sometimes it's difficult for them to get to the Social Security Administration building. We do mental health screenings. The tax assistance is next door. The list goes on. We try to partner as much as we can. The idea is what they call one-stop shopping. We try to have as much at the center for the seniors so they don't have to go other places to get those programs and information. We have senior tours that keeps the seniors on the move, and this is a picture of Ann Burnett. She is a volunteer who coordinates our trips for us. Very important for everybody to note that senior trips are completely self-supporting. There is no county money that goes involved in them, but it is a wonderful service. We have a lot of, say as an example, an 85-year-old woman, she is a widow. She still wants to go out and do things, but she is not comfortable traveling alone. She doesn't feel safe, or maybe she can't plan the whole trip. So we plan these trips and they get to go out and do and participate. We'll do day trips that are short and inexpensive, and then we'll do long ones. We also partner with other agencies to provide entertainment. I work quite often with Goldsboro Parks and Recreation Department and the Goldsboro Family Y. We do dances, and I tell you, anyone who thinks seniors are boring needs to come to our dances. I have about 150 at the last one. We have a DJ, we have food. It gets hopping in there. It really does. We have a great time. We do senior day in the park with them, senior games. This photo is Stacia Fields does line dancing lessons at the senior center twice a week, and she gets about 70 seniors that like to come to the class. Transportation is also an important part of the funding. I'd say about $100,000 of our funding actually goes to Gateway to pay for rides for the seniors. The seniors need to go grocery shopping. They want to come to the senior center. They have doctor's appointments. They have dialysis. So we coordinate those rides through the Gateway van system. I'm also proud to say that we are a pilot project for the state, the only one. When we were moving from our old building to our new building, I was worried about losing some of the seniors who used to walk to the building. They lived in downtown Goldsboro and would not have a means of getting to the new center. Well, if I put them on the van system, it would be $8 to $9 a ride, and that's a lot of money. So working with Gateway, with Terry and County Manager and Eastern Carolina Council, they agreed to this pilot system. We created a little bus pass, and it has 20 circles on it, and the seniors can ride the bus system anywhere they want to go, and it's punched once each time. And then when it's filled up, they turn it into us, and we give them a new one. So I'm able to give them transportation for 50 cents a ride, much better than $8 a ride. And we just had our first review from the state. They seem pleased with it. We're hoping they'll let us continue it next year. In terms of trends and budget issues, of course, my biggest concern is budget cuts. Sequestration, they talk about, maybe a 5% cut. I spoke with Tanya Cedars. She's director of the Area Agency on Aging, and she said of our block grant money, about 40% of it is federal. So there is a possibility that we might lose 40% of the 5%, which for me would be about $12,000. If I do lose that, it probably will mean a cut in services. I'll either have to cut back on rides or cut back on the in-home aid or something like that. Also, an issue for us is called the silver tsunami. I don't know if you're familiar with that term, but the number of older adults is increasing and increasing and increasing. The statistics that I have with me is 2020, they're expecting about 26,000 seniors in Wayne County. 26,000 people will be over age 60 by 2020. So how will we meet their demands? How can we meet their demands? Medicare counseling is sort of hand in hand with that. As more and more people are getting older, more and more people qualify for Medicare. Medicare is really complicated. There's Medicare A, there's B, there's C, there's Advantage plans, there's drug plans, there's supplements, and they can change every year. So for a senior to keep up on that, I know I have trouble understanding and keeping up on it, and an 85-year-old senior could have a really hard time. So we get a lot of requests for counseling. I would say daily at this point, more than once daily, people that just need to be seen. Another interesting question that we face is meeting the needs of a divergent senior population. We have 60-year-olds who are seniors, and we have 90-year-olds that are seniors. Well, a 60-year-old has really different wants and needs and desires than a 90-year-old, and yet we're going to try to cover their needs. And so it's going to keep life interesting. We just have to be creative, I think. And then parking. We have a lovely parking lot, but when we have a very big event, sometimes there's been issues with that. I'm working on getting the seniors to carpool. The county manager was able to broker a deal with the business next door that we can use their parking lot, so that helps. And the county, or the city put up some signs, no parking signs.
No parking on one side of the street. It did get a little dangerous on both sides, but they're allowing parking on one side because we have buses that go through there, and it was a little dangerous for the protection of seniors. And
so generally day to day, not an issue, but if we have a really big event like that health fair that I had 400 people at, then they were just having to park down the road. And we're hoping more people will carpool and more people will use Gateway. And that is my presentation. Thank you very much. Does anyone have questions?
Questions, comments? Mr. Daughter?
Did I understand you to state that $100,000 of your budget went to transportation cost?
Yes.
100,000?
Yeah, we provide rides all year long to seniors for Gateway, and as I said, some of those rides are $8 and $9 each way, so it really adds up.
And you're saying that currently you have approximately 500 seniors that you're servicing?
500 seniors came into the senior center this month alone. We have other seniors that we provide service to that don't even come into the center.
Okay, so it's beyond those people that are using the center.
Right. Yeah, we do dialysis, we do doctor's appointments, going to the hospital, grocery shopping. There's a meal site in Mount Olive that we transport seniors to so they can have lunch.
Well, I think one of the concerns, and and I'll be the bad guy here, one of the concerns that I would have is the cost, the expense. I mean, you're speaking of, the projections are, we're looking at an aging population with 26,000 seniors in Wayne County, and how do we provide this level of service going forward? If the cost to the county at this point is at this level, what is it going to be on the out years?
Yeah.
And I think we all are going to have to make some tough decisions as we're looking at that. Now, no one likes to look at everything from the standpoint of cost, but we are forced to that, to look at that. Have you considered or looked at any fees or any user fees or anything along that lines in regards to help sustain the programs going forward?
I think I want to make sure you understand for the transportation that is grant money, $100,000 of grant money that is stipulated. I cannot charge any fee for that. We allow people the opportunity to share in the cost, it's called, and they can give if they want.
Oh, not in transportation. I
Yeah,
was
okay, but-
talking about these other services that we're providing as such.
Yeah, so depending if it was grant paid for, like the in-home aid program, once again, grant can't do it.
Understand.
The senior centers around the state have, some of them have wanted to do a user fee, and that's not actually allowed through, say, that Senior Center of Excellence. I wouldn't be allowed to be a Senior Center of Excellence if I did that, depending on, it would have to be something that's solely county money that would allow you to charge a user fee.
A lot of the federal grants, well, most of the federal grants don't allow in the senior programs, dollars that flow through East Carolina, ECC won't allow us, because we've researched it.
Yeah.
When Yvonne was director, she and I looked at it, we've looked at it, won't allow you in most cases to charge. With the rides, they can volunteer. It's like with the meals.
Right.
You can't charge,
No.
but they can give something if they choose to.
So if we decided to charge, we would lose $500,000 in funding a year. That's what the rules are.
So here's the string here. We're going to give you a grant or federal dollars, but as a result of that, there can be no user fees at all
Absolutely.
That's right.
Correct.
for any service.
Well, no.
Except for those that are only county-owned, operated, and funded.
Right.
No,
So there are some services,
but they're very small.
well, but
It
there are
might be,
some.
let's say it's a painting class that we offer that's Wayne Community College. I'm just,
Lynn Community College charges for those.
they charge for
Typically, I
those. But
have
they're saying, I'm
volunteers.
saying, there are local programs that you could. Now, I have to give because, and I see what you're saying, and there's something we really talk about, because I think it's something we are facing. The flip side is, and I'm gonna sound like an advocate, this is not advocacy, this is just the issue about dealing with the issue of seniors and quality of life and staying at home. And Aaron really was the one that brought me to the point that I really get assisted living nursing homes of the cost of $6,000 to $8,000 a month, instead of that cost of $6,000 to $8,000 a month, which typically was paid by Medicaid.
Definitely.
Instead, we get this $100,000 and another couple $100,000 to help with the center. Just 2 patients cost the same thing, but yet I serve 500.
Right,
So,
right.
so I get that, but we absolutely get what you're saying, and we examine it all the time. And as that number grows, I think we absolutely are going to have to look at how do we contend with that. So, I mean, you make a great point, but I
maybe
try to let you know we
parking.
are looking at it.
Maybe parking. I don't know.
Charge for parking.
Well, we'll charge for the shuttle.
Something like that.
Well, and one final question, and that is, in your program handling Alzheimer patients, I think that's commendable. But with that in mind, are none of those services, none of those are billable to Medicaid?
No, when we do our screenings for who can qualify for these programs, if you have Medicaid, then you're expected to go to a program that Medicaid can offer you. So it's like our transportation. We don't transport a senior who qualifies for Medicaid because they can get Medicaid elsewhere. This
So in other
program-
words, they won't pay for this good program, but you'd have to go to another program and not this.
But we
particular
take private payers. We have private payers also. You know, people can
But
come in and
but
private pay.
Medicaid would not offset any of our handling of.
They would have to go
of
to a Medicaid
Is that right?
program.
Okay, I appreciate it, thank you.
Mr. Bell?
Thank you, Aaron, for a job well done. I just want to make this comment to the commissioners, just for informational purposes. Out of all these countries in the world, the most industrialized countries in the world, we are at the rock bottom in how we treat our seniors. Everybody's ahead of us. You know, so we take a different view about how we contribute, and, you know, seniors have paid their way, if you just stop and think about it. You know, they have gotten to age, I might be talking about myself a little bit now, too. But,
They may be in the U.S., but we try to treat them great in Wayne County.
Yes, we do.
yeah, well, that's what I'm thanking her for, because we
Yeah.
do a great job here in Wayne County.
Yeah.
But this country as a whole, we are number 15th in the world as to how we treat our seniors.
Well, and I would make the argument, aside from the fitness and these programs that we are doing that are keeping people at home and keeping them out of institutions, keeping their health, and so they don't have a stroke, so they're not costing a lot of money, is also the senior center is an asset from attracting people. We want Seymour Johnson Air Force Base to stay. We want them to be happy with us. I have a lot of retired military that are coming to the senior center and loving it. So this is an attraction to Wayne County. There aren't many counties that have such a lovely facility and so much to offer a senior. So these seniors are paying taxes. They don't have children in the school system. So it's a benefit. I think it really is worth the cost to you.
Mr. Cromartie?
Mr. Bill actually made my speech for me, but I just was just on the verge of looking around in the room here and looking at the white hair that's starting to develop even on this board here. And as you get a little bit closer, well, no, I am beyond the 60. Thank goodness I can still take myself about. But I see every day folk getting on the gateway and different things that's provided on their way to dialysis, and they are able to stay at home because they're being able to be transported to dialysis, for instance. That's something that I see in Mount Olive quite a bit. And of course I see the seniors also going back and forth to the seniors building, and I don't know everything they do there. But the one thing that I want to go back and focus on what you said, you card the folk in this Wayne County citizens who are using this service, and they did and do pay their taxes, and so that's a service that I'm proud that we can afford.
Thank you.
Anyone else? Any comments? I have just one to recognize Mr. John Bell, Commissioner John Bell, that when I came on in 2008, he was championing and really actually spearheading the senior center from 2008. He was representing the commissioners, as we each do in each individual department or area, and he did a great job in this project from day one. And I'd like to take this moment to thank Commissioner Bell for all the times that he attended and went to these meetings. I started going to the meetings in 10 and 11 and immediately saw how influential he was in spearheading this. And I'd just like to thank you, Mr. Commissioner Bell, for doing this.
Commissioner, I have to kind of compliment you since you're doing this complimentary thing today. You had a little hand in that too. So.
Well, thank you. But you have, and I really appreciate that. But to wind my part up on this is, again, of what Mr. Daugherty had talked about of trends and sustainability in anything that we do. We have a great product. We have great citizens that are doing this, but also when you look at the trends and you go from 75 to 80 people that you're feeding, and then all of a sudden you have 120 a day, and we built this facility for 210, then you have WAGES, and WAGES is a great system, a great department in what they do, but it requires funding. And here again, it's our responsibility to watch the funding arm, whether it's federal, whether it's state or county. And as we see these trends, we have to be on our guard within the next 4 years on this course. Is that what we're seeing now? If we go to 210, then when WAGES says we need this, or Gateway says we need this, we just have to understand that. And here again, this is just a very small part of the governance of Wayne County, and working with Goldsboro, because you had mentioned that there were a lot of people walking to the center from Goldsboro. So we have to look at the municipality, which I know Commissioner Bell, I've heard him say many times, we're there for all people. And but his constituents in Goldsboro, he has spearheaded this for his constituents, and we certainly want to do it for the rural area as well, as we have shown in Gateway. So looking at sustainability and the trends for particularly the next 5 to 10 years is critical and paramount that we do that. We support you. We appreciate all you've done. You know how much I have tried to keep you going and push you, and I'm amazed at how you can and stand there with no notes and just click it off. You eat, drink, and sleep this, and as Commissioner Bell knows, you are you were a diamond in the rough, and we're just glad that we've got you and your staff working the way you do.
Thank you.
Thank you.
I hope we have your continued support.
Yes, thank you so much.